Joining us live right now to talk a little bit more about the Johnson & Johnson vaccine is our infectious disease expert, Dr. Aileen Marty. And Dr. Marty, just tell us a little bit about, for the people who have already had the Johnson & Johnson vaccine, who may be really concerned about their own health, they probably don't have a lot to worry about if they haven't already had a side effect, correct?
So that's basically correct. It takes about 2 weeks, more or less, to form the kind of antibodies that have been detected in a very small number of people with AstraZeneca and now possibly with the J&J vaccine. And so these are antibodies that affect these very special cells called platelets and their products that are involved with coagulation. Now, in the case of Johnson & Johnson, only six people out of 6.8 million have manifested these symptoms. And again, it happens and every single one of them that manifested it did so within that 2-week period, right, after the vaccine. So if you're beyond those 2 weeks, then you didn't form those antibodies and you're absolutely fine.
And Dr. Marty, when we're talking about vaccines in general, it's very important to note, like you said, 6 cases out of almost 7 million doses. And we look at the Pfizer and Moderna vaccines. It's important to note that vaccinations are very, very safe and effective.
Vaccinations are very safe and effective, but I will say there are differences between the different vaccines. There are different platforms that have been used to create these vaccines. And right now, the best safety and efficacy by far are the messenger RNA vaccines.
All right, Dr. Marty, thank you so much for helping us out to sort of sort through all of this new information. As always, we really appreciate your guidance during this pandemic.